feel like it's going to be the end. You just can't get any air in your lungs. It's a horrible, horrible feeling. You have no air to breathe. You're just struggling. My doctor suggested that I come down and see Dr. Martin.
I'm Dr. Andrew Martin, Chair of Pulmonary Medicine here at DEBOARH Heart and Lung Center. We're here in the bronchoscopy suite to talk about bronchial thermoplasty for severe persistent asthma. Asthma is a disorder of narrowing of the airways which occurs from time to time. This episodic narrowing causes chest tightness, cough, shortness of breath, and chronic sputum production. Sometimes these episodes are so severe that patients have to go to their doctor's office or the emergency room unexpectedly, and occasionally have to be admitted to the hospital. I
could be at the ER 3-4 times a month. I was hospitalized at least 12 to 15 times a year. If someone was sick, I couldn't be around them. If I overexerted too much, that could trigger it off. Pollen counts were high, and that would trigger it, and then I'd go into an asthma attack. And I had to really be careful with my grandchildren, you know, being around them. I would start coughing and then wheezing, and the wheeze would really get violent.
Bronchial thermoplasty is a procedure where we address the excess muscle around the airways. Bronchial thermoplasty is not for all patients with asthma. Bronchial thermoplasty is for patients with severe persistent asthma. This is defined by severe exacerbations occurring despite therapy with high-dose inhaled steroid controller therapy and long-acting bronchodilator therapy. These exacerbations are characterized by unexpected visits to a physician's office or emergency room, resulting in steroid administration or admission to the hospital.
It was terrible. The implications of being on the steroids and all the side effects of it, but yet I needed it to breathe. So you had to be on these large doses of steroids, and that was terrible to have to deal with. Never did I think that they'd say I was a candidate for it, but I was so thrilled to be a candidate and to be able to have the procedure done.
Done through a bronchoscope inserted into the lungs. A catheter is inserted into the airways, and using radio frequency pulses that are very carefully calibrated, the airways are warmed gently, and this results in a reduction in the muscle around the airways. This reduction in muscle leads to less episodic narrowing and fewer severe exacerbations and symptoms.
He puts apparatus in there and clears out the lungs. You don't feel a thing.
Bronchial thermoplasty doesn't hurt. The bronchoscopy itself can cause some throat discomfort, and occasionally patients have a slight worsening of their asthma symptoms after each procedure.
I feel after the first one I could feel a difference.
Bronchial thermoplasty is delivered in 3 separate procedures. These procedures have to be at least 3 weeks apart. We treat one lower lobe in the first procedure, the other lower lobe in the second procedure, and in the third procedure we treat both upper lobes.
I can't tell you how wonderful I feel compared to the way I felt before, like a new person.
So far, the patients we have done here at DEBOARH have reported decrease in symptoms, decreases in steroid administration, and improvement in their quality of life.
So I was on steroids for, I bet, 50 years. Now, of course, I'm not on any steroids at all. It's wonderful. I can go out, I can go places, I can go for an activity in a yard, a picnic, which I couldn't do before.
After bronchial thermoplasty in clinical trials, patients have experienced 32% fewer severe asthma attacks, 84% fewer emergency room visits for respiratory symptoms, and 66% fewer days lost from work, school, or other activities due to asthma symptoms. In addition, 79% of patients treated with bronchial thermoplasty did experience a clinically relevant improvement in their asthma symptoms and quality of life.
I'm able to be around these 3 wonderful My daughter has 3 children. She just had a little boy. I wouldn't have been able to be around him, but now I can. It's like night and day. It really is. It's just wonderful. Dr. Martin in the pulmonary division is super. Everyone at DEBOARH Heart and Lung has been wonderful to me. They really have. From the first day I put my foot in the door. I would highly recommend this procedure to anyone who's an asthmatic who would benefit from it. It is wonderful. And the results are fantastic.